So good afternoon, everyone. Today is our meeting. As every month, we are just working together in our Global Integral Beauty Networking. This is our meeting with all the American community. As everyone requests, it is very important to know how big and how is increasing this amazing industry in this area. As everyone know me, or if somebody are here new, my name is Idalis Bailey with more than 16 years experience. A registered nurse with MBA in marketing, skincare specialist, New York State licensed medical esthetician too. Also, an international speaker in the field in the marketing and aesthetics, and host the Hashtag with Idalis with the podcast and interview too. This is a special time that we are investing every month at the end of the month at the same time. One day we do with the English community and one day we do with Spanish community. Usually we do in this time because Europe, some of the community, the professionals of the community are in Europe. So just to get an idea that they can have the opportunity to be part of this networking. The first question is, from your area of specialization, what professional factors are essential to build an effective aesthetic oncological treatment?
So I think one of the most important things people have to understand, and us being within the skincare industry, is compassion. You know, we all come into this industry wanting people to feel better about themselves. I think that's probably one of the very first things you've got to understand is, you know, when you're working with oncology patients, is you have to have that understanding that they're going through something far more expansive than who we are and what their normal life is. And they're going to have challenges in terms of their skin or internal, you know, their organs, their vital organs and things. And it's just one of those things to understand that we can help them, you know, time throughout their journey. Like Alicia said, was the fact of, you know, the physicians, unfortunately, when it comes to integrative wellness aspects like we do, they don't really see it as something that should be appropriate for us to have as a practice, because they're just focusing on doing the radiation or chemotherapy or whatnot to make sure that they can get through these things. But the biggest thing that feeds cancer is stress. So if you're going through that journey, I think being able to come into someone that's, you know, trained and certified to be able to work with you during your journey of skincare or body treatment or what have you, I think is a really important thing and the compassion towards yourself and what you're going through. Secondly, also is making sure you have the understanding and certification that to work with these people and to make sure that you are not providing a service that you're not certified to do.
Thank you, Alison. Now the question is for Alicia.
So one of the best things about what Miss Allison just said is that LED light therapy helps with lymphedema. So adding this to your treatments can actually help prevent their future and continue to help them along for the rest of their lives. The blue or the green light would be best for that. So essentially, aesthetics and oncology goes together because you guys know the colors, those light bulbs that are in all of your machines, the red, the blue, the green, those are light emitting diodes that were created by NASA. And then other people just took the patent, and once it's able for everyone, then we just use it even in our light bulbs and stuff nowadays too. So you guys are already using LED. If you're doing body contouring, you're using LED.
What aesthetic treatment can be performed to help a patient during the oncology process?
So there's a few different options you can do. The biggest thing you want to make sure is that you're not going to interfere with their treatment, because obviously chemotherapy is going to kill off the cancer cells. So when you are utilizing things like what Alicia uses, it's going to be really important to make sure that it's okayed by the doctor and things. But skincare is going to be something you can do. Now, in saying that, what are the contraindications, or what are the things that can happen while your patients are going through oncology, like their oncology treatments? Well, there are things like hand and foot syndrome, where basically they're becoming cytotoxic and it's bleeding through their hands and feet. What happens with that? They become red, they become irritated. You know, things like when they are cytotoxic or they are having, are radioactive, making sure you are working with them to ask them, what are your naders at? And your naders are your red blood cell counts, your white blood cell counts, your platelets, things like that. Because if they're immunosuppressed or immunocompromised, obviously you don't want to bring them into an environment where there's potentially people that are going to affect them more than they should, right? We don't want to get someone sick while they're going through treatment.
LED light therapy, you talked a little bit more before. I would like that you explain more details. Light therapy recommended for oncology patients, and what another technology do you think that can combine with the LED too?
Yes, I am super happy to be here and totally debunk the notion that LED has to wait until after. That's completely untrue. As long as you are communicating with the patient's team and their medications allow it, LED light therapy can be used during treatment. It actually can aid with the treatments if they're taking the right medication. There are treatments, cancer treatments, that don't use chemo, that don't use anything. They only use LED and a drug that makes the cells light sensitive, among other things. So one LED light that you can use is low-level laser therapy, and this can be done while in chemo, while in it depends on the patient, of course, and it depends on the patient's team, and it depends on the knowledge and the expertise that you guys have among that patient's team. And so some of the things that I want to touch on, so light emitting diode technology has shown promise in various applications for oncology patients. Some of the proven investigational uses of LED technology in oncology include photobiomodulation therapy, which basically uses the blue light to help clean and heal. Photodynamic therapy. Now this is where they are using specific drugs because the problem with cancer drugs is that they don't really know what address they're going to.
Alison, do you recommend any special branch for the LED, or Alicia?
The ones that I have were just like some of my machines. I have them with my machines and things like the hydrofacial and the oxygeneo both come with an LED to go as you're going through treatment. So I tend to just use those. But there is a company that does, I don't know if Alicia can speak on this as well, but that does, I think they're called NeuroCare, and they're in Florida, I think. And they have different professional and at-home treatments, whether it's to do with scalp, like they have a cap that you can put on, or there's different pieces to put over legs or arms and things like that. So those are the ones that I kind of work with. I tend to do more of, I do have LED, but I tend to work more in terms of just rehydrating the skin and making sure that they're, the lymphatic system's kind of cleared and things like that, more than the actual LED itself. But I do LED in most of my treatments on my clients, even on myself. I'll be sitting watching TV, kind of doing my treatments on me and things like that. But LED is a huge anti-inflammatory to the skin, right? Like Alicia was saying. So it's super important to be able to integrate both of them. you know, as I said, it's just more of the oncology team sometimes is just like, stay away from everything. Even vitamin C infusions, they don't want you to do. Oh, it was wonderful. I love doing things like this. I think it's really important for people to be able to have, who are in the industry, who are able to see different parts of the industry that they may not know about. You know, there's not many of us who are oncology estheticians, right? And just because you have the diploma oncology esthetician doesn't mean you have to be an esthetician. You can be a nurse. I've trained nurses. You know, my last training I just finished, actually last week, I just finished a group that one of them is an ex-Army vet.
Thank you so much for reaching out to me. I love being a part of this community. I can't wait to encourage you all to go and be assertive about LED and get it out there. There's the only way to continue to get data is to continue to be assertive in using LED for more than just aesthetics. LED is an overall healthcare treatment. And so, yes, it does help with aesthetics. Aesthetics is a great way to introduce LED to people. And I thank you for the space to be able to do that and get it out there.